Very good, Martha. Thank you very much. I hope now that things are clear what is informal sector and who are the informal workers in the informal employment and what are their challenges. So they did a great job of enlightening us and teaching us about the informal sector. We have another 10 minutes for questions, answers, comments, that you are mostly welcome to raise your concerns or to make suggestions that we can pick up later on. But the floor is open. It's yours. I think Martha was very, very challenging that she said, I didn't see the private sector there.
No, I'm glad to see it, but I'm just saying that there have been other kinds of public-private partnerships all along. Yeah.
Yes?
Thank you. Thanks both of you for your presentations. I had spent a fair amount of my career when I was in the Foreign Service in Africa, and I'm still shocked by the statistics, I have to say. To think that the lowest number of the regions that that Martha had presented in terms of informal employment as a percentage of non-agricultural employment, which is focusing, of course, on the developing world, not the developed world, was 45%, and the highest was 82%. This is obviously huge, and what we're talking about today it has to feed into the discussions that are going on in New York about the post-2015 development goals, because there's really a consensus on universal health coverage, but I'm not sure that a lot of the people who are discussing it in New York recognize the ramifications of this, because it's not the employer-based emphasis that people, in many cases, I would assume, believe would be the way forward to achieve universal health coverage. And I just want, so this is more of a comment than a question, but when, Ivan, when you had said at the end, messages for your consideration, universal health coverage involves some, if not total, delinkage of health coverage from employment status. And then, Martha, you said in yours, when one of those that was not italicized and not bold, which means you didn't like it, was the employer-employee relationship to provide the health services. I take it that both of you are saying that we've just got to move beyond this employer-based coverage, and because it won't work if we're going to achieve universal health coverage for the informal sector. And that's, maybe everybody else here knew that before they came in the room today, but to me I find that quite striking. So it's more of a comment than a question. Thank you.
Very good. Thank you, Ambassador. Yes? Go ahead.
So I kind of follow up a little bit on that. So it seems to me that if we're looking at definitions where 50, 60, 90% of the workforce is informal, sort of the kind of logical response is, well, what does it mean to be formal? And the implications of the information you presented to us really seem to me to be that there is a profound transformation, or potentially a profound transformation, in the model that one had about the future of employment and services. Okay, and that the implicit model historically was people would move into formal sector employment, and some combination of the state and formal sector employers would assure the coverage with services like health and other things. And countries differ a great deal how that combination takes place, whether it takes place through mandates or through taxes, or, you know, there's all kinds of different examples of how this is done. And what we see in health coverage, basically, when we look at advanced countries, is many, many kind of mix and match combinations of different kind of structures, all around a similar outcome, which is just about everybody has a fairly good coverage with a fairly good package of benefits in advanced countries. So I want to kind of pose this as a question. I mean, if this model, is this model delayed, or is it profoundly restructuring in a world that has changed? Because that has pretty significant implications for thinking about policies and strategies going forward. There's been a growing concern or even a debate as to whether things like universal health coverage are actually going to increase informality. Because if you create systems where, let's say, governments cover health, you essentially allow employers to not cover health. And you reduce one part of what is currently formality. I think there's the data on this is rather mixed right now, but this is something that's been raised as a concern in Mexico, for example. So I just wanted to pose those as questions as to where this might be going. And I mean, it seems to me if 90% of the workforce is in the informal sector, then talking about something like universal health coverage without the informal sector is kind of nonsense. So.
Yes, I think that this is a very challenging remark, particularly if we keep in mind that the schemes that are currently being discussed for universal health coverage, they are a combination of social health insurance and other non-contributory schemes. So the employers, they will always have the responsibility of providing contribution to the health insurance pools. The question is how to create an opportunity for other members of the society who do not contribute or who cannot contribute actually to these pools to also access health services. So this is the debate. There's no debate about moving away from social health insurance. The debate is how to create an opportunity for other people to access health services without compulsorily making contributions because they cannot.
Yeah, I think I would just say a couple things. One, microphone, okay. The WIGO network is not wanting to let employers completely off the hook. So even if it becomes a system where it's not based on employer or payroll deductions or whatever, there's still paid leave. There's other aspects that will help on protecting workers that we have to keep in mind. That's one point. The second point is that if you look at the models that Ivan showed, as he just said, some countries like UK, it's the single payer, it's the whole thing is government and tax-based. If you look at Thailand, which is a success case, you still have the employer-based contribution system. And then for those who weren't covered by that, you have what's called the universal health coverage, which started with a premium, and then they dropped it and became fully taxed. So they're a mix of models. And I think the cases where, like Mexico, where there's this debate as to whether it creates an incentive for informality, both from the firms and the workers, is because it's a segmented model. You have the formal social security system for the formal workers, and you have a targeted scheme for the informal workers. That being said, I have spent quite a bit of time with Santiago Levy challenging his data and his assumptions on that. I mean, I think even that is still up for grabs, but I don't think a truly universal, where it's all tax-based and all that, will necessarily increase informality. But when you have these segmented models, that's when you get that debate on whether it creates a perverse incentive. In terms of your other point, Peter, our thinking is that there are countries like China where perhaps you are going through a delayed point at which there's more modern wage employment, that you don't have an endless surplus pool of labor, and things are beginning to happen the way Arthur Lewis predicted, right? Our feeling is, but that's not going to be what's happening in other countries, that there is a structural shift. And it's not just we're waiting for that famous moment of modern. And on that, I would also say that in the global north, where we had mass employment in the 50s and 60s, but some people will point out that that was for white men, and not for people of color or women necessarily. What we're getting now is much more informality. So even the part of the world that lived up to that prediction of mass wage employment with industrialization, we're getting much more informal wage employment. So I think we really have to assume that informality is here to stay, in that sense that it's normal, and especially the self-employment, that a lot of people are going to have to make their own jobs, and certainly that's what's happening in the aftermath of the financial crisis. So I think we have to assume that employment is going to stay different than our models, and our models and our systems have to change to fit that reality.
You will see in the paperwork that is given to you by the Secretariat, you have the outcome document of the open working group of the UN preparing the Sustainable Development Goals. This is the proposal that was put forward now for the UN General Assembly. And in one of the targets on Goal 8 on employment, there is a target of changing macroeconomic policies and environment so that it leads to formalization. And there's a strong focus on micro and small enterprises. So that is one of the hooks for the direction that is being proposed for the so-called informal sector.
One last question, then we'll be off for lunch, which will be provided outside for you. You can bring it back in here, or you can take it up to the atrium and eat it there. Thank you.
Hi, I really liked your last slide, and I wonder how much that can be generalized beyond the informal health sector to sort of anyone who's not employed or general population who desire health services. From where I sit, with PEPFAR, we look at, the population and the disease burden and the service provision, and we think about both who provides those services as well as who's paying for those services. And so it raises some questions for me about the role of foreign donors, government donors, bilateral donors, multilateral donors in the payment structure of those services, both through public and private means. But really, I like the kind of catalog of services that you've outlined, and just wonder your thoughts on how that can be generalized beyond just the informal sector to kind of all uninsured or unemployed constituents.
I'm the first to confess I'm not a health expert. I'm an informal economy expert. So I think that question would have to be answered by the health experts. This sort of reflects a lot of thinking with the partners that are here. And Francie Lund and Laura Alfers from Durban, who lead our social protection program and interactions with the ILO's social floor, but I don't know enough about the health system to be able, writ large, to be able to answer that.
I'm sure the answer to this question will come throughout the workshop, because it's not very, very simple answer. There are different aspects of what are the general health needs of people, those of them who are workers, and what are the specific work-related health needs. So how general health needs would be covered, how the work-related health needs would be covered, what are the schemes, and what are the specificities of the informal sector.
Thank you. We'll see you at 1:50.